Okay. As you all know, uh, actually, there are certain enzymes in certain tissue. Okay, and they are normally reside inside the tissue. But if it is leaked into our circulatory system, it means something happen or damage might happen uh, at that particular tissue. Faham tak? Ha. Faham Okay. Alright. Okay, that's how we do. That's why we do plasma enzyme test diagnosis. Okay. Alright, so for today, we are going to take a look into the release of enzyme from the cells, selecting plasma enzyme test, example of clinical importance plasma enzymes, and also biochemical test in myocardial infarct. Alright, okay, now let's start with the introduction. Okay, as we know that enzyme play many important role in our body. Okay, it is a protein catalyst that increase the rate of physiological reaction in our body. Alright, it also aid in digestion, also important in turning food, digesting food, then and turn it into energy that needed by the body, and then important for growth and cell repair, right? So in general, most enzymes are present in cell, okay, inside the cell, at much higher concentration than in plasma. Okay, but when a condition where the enzyme is high in the plasma, must be something wrong with that particular tissue, sebab dia takkan leak into our circulatory system. Okay, measurement of their level in plasma indicates whether their tissue of origin is damaged, okay, leading to the release of intracellular component into the blood. Okay, for example, for liver disease, okay, you can find the level of enzyme, we call it as ALT, is high. Okay, kalau ALT high, maksudnya there must be something wrong with the apa? With the liver. Sebab dia memang specifically inside the hepatocyte. Okay, tapi tiba-tiba dia dapat we can detect it in the plasma. So something wrong with the hepatocyte lah. Okay, so plasma enzyme diagnosis refers measurement of enzyme activity for the disease and treatment of the disease. Okay, so far boleh dapat ke? Faham ke? Boleh? Right. Okay, the release of enzyme from cell. Okay, the changes in plasma enzyme activity are nearly always due to increase in the rate of release of enzyme into the circulation, and commonly caused by necrosis. Okay, severe damage of the cell. Bila cell damage, dia akan burst and dia akan release the enzyme that reside in that particular cell lah. Okay, faham Alright, that caused by ischemic or toxin. Okay, increased rate of cell turnover during active growth, tissue repair, or in cancer. Okay, increased concentration of enzyme within cell, usually a result of induction by disease or drug, and also due to duct obstruction. Okay, enzymes normally present in exocrine secretion like amylase may be regurgitated into the blood of the normal route of outflow is obstructed. Okay, dia sebenarnya dia tak ada pun dekat dalam blood circulation kita, tapi disebabkan ada obstruction, kita boleh detect dia di dalam our circulatory system. Okay, there are two types of plasma these are the types of plasma enzyme. Okay, plasma that have definitely a physiological function in the circulatory. Okay, yang biasa kita jumpa in our circulatory system is lipoprotein lipase and also proenzyme of blood coagulation. These are the two the two enzymes that can be found in a normal condition. Other than that, maybe it's due to damage of that certain tissue lah. Okay, faham Okay, and then the enzyme that reflect organ pathophysiology. Okay, normally present in extremely low concentration in plasma as compared with their high concentration in their original tissue. Okay. In case of tissue damage, they are released in greater amounts, causing higher plasma level, which have diagnostic and sometimes prognostic significance. Include enzymes that present in exocrine excretion, diffuse passively into the circulation. Like for example, lipase and amylase in pancreatic disorder. So kalau kita dapat detect lipase and amylase is might due to pancreatic disorder. Okay. And then intracellular enzyme. Okay, intracellular enzyme tu maksudnya enzyme that reside inside the cell. Okay. Enzyme used to detect pathological disorder of the various organs of the body, for example, myocardial infarct and also hepatitis. Okay. Okay. Okay, let's see types of plasma. Functional plasma enzyme. Functional plasma enzyme ni yang ada dekat dalam our normal circulatory system kita lah. Okay, and then non-functional plasma enzyme which is not appropriately kita detect in our plasma lah. Okay, the concentration in plasma, okay, it present in plasma in a high concentration compared to tissue sebab dia memang originally dekat plasma. Okay, so we found it low concentration in the tissue. And then for non-functional plasma enzyme, normally present in plasma in very low concentration as compared to tissue. Okay, the function for functional plasma enzyme, they have known function. Okay, and if we found non-functional plasma enzyme, the function in the plasma, there is no known functions. Okay, the substrates. For functional plasma enzyme, their substrates are always present in the blood. Okay, while for non-functional plasma enzyme, their substrates are absent from the blood. Okay, site of synthesis, the functional plasma enzyme from derived from liver, while the non-functional plasma enzyme, different organ like liver, heart, brain, and skeletal muscle. That's why if we detect them in the plasma, we already know, okay, mana origin of this enzyme. So we can narrow down to check which tissue yang damage ataupun ada problem. Okay, faham Okay, and then the effects of the disease, disease in the liver disease, decrease in the in liver disease, sebabnya it produce from the liver kan, by the liver. And then for non-functional plasma enzyme, different enzyme increase in different organ disease. Okay, for example, for functional plasma enzyme, clotting factors such as prothrombin, lipoprotein lipase, and pseudocholine esterase. Okay, for non-functional plasma enzyme, the examples are ALT, AST, CK, LDH, alkaline phosphatase, acid phosphatase, and amylase. Okay. Sources of non-functional plasma enzyme. Okay, these are the enzymes that we want to take a look for today's class. Okay. increase in the rate of enzyme synthesis. Okay, for example, bilirubin increase the rate of synthesis of alkaline phosphate in obstruction in liver disease. Okay. Obstruction of normal pathway, like for example, there is an obstruction of bile duct that increase alkaline phosphatase. Increase the permeability of cell membrane as in tissue hypoxia, and also cell damage with the release of content of enzyme in the blood, like for example myocardial infarct and viral hepatitis. Okay, the medical importance of this non-functional plasma enzyme, it is important for diagnosis of disease. Okay, disease of different organs cause elevations of different plasma enzyme. Okay, and also it also important to monitor the prognosis of the disease. Okay, it is useful in follow up the effect of the treatment by measuring plasma enzyme before and after the treatment. Okay, measurement of enzyme activity. Usually we measure the enzyme plasma using international unit IU per liter. Okay, it corresponds to the amount of enzyme that catalyzes the conversion of 1 micromole to product per minute per liter. Okay, that is the explanation for the enzyme activity that expressed in IU. Okay, so now let's move on to the diagnostic enzyme in different disease. Okay, okay, if the patient had a heart attack, okay, the main enzyme that being observed is that can be found in patient with heart disease are CKMB, LDH1, ALT, and AST. Okay, for liver disease, the hormones that involved are the enzyme that are involved is ALT, AST, LDH5, and GGT. Okay, for muscular damage, we can see there is a high level of CKMM and also LDH55. Kan semua berbeza kan? So that's how we narrow down the diagnosis of the patient. Okay. Alright. Let's take a look one by one. Okay. Okay. So we have here lactate dehydrogenase (LD). Okay. LD is widely distributed in the body. Okay. And the normal value in serum is between 100 and 200 international unit per liter. The upper range usually seen in children. Okay, so we can expect the children LD is higher than adult. Alright. Strenuous exercise will also cause slightly increase in LD value. Okay, level of LD is 100 times in the RBC than in plasma. Faham tak? Plasma kan sel kan, red blood cell. Red blood cell kan sel kan. So the rate of LD is higher in red blood cell as compared to plasma. Nampak? Okay, alright. And if there is minor hemolysis, will result in false positive test. Okay, sebabnya kalau ada hemolysis pecah kan, RBC tu pecah, so LD will release into the plasma. Alright. Level of in myocardial infarct, the total LD activity is increased. Okay. Okay, LD is most often measured during myocardial infarct. Okay. The magnitude of the rise is proportional to the extent of MI. Lagi teruk, the seriousness of the disease lagi tinggi lah the level of LD. Okay, this difference enabled the lab to distinguish two main patterns of LD, isoenzyme in plasma in disease. So isoenzyme is actually it has each of two or more enzyme with identical function but it has different structure. Okay, dia sama, function dia sama tapi dia ada different structure dia lah. That's why dia ada macam-macam nama, CK, MM, CK, BB, CK, MB. Alright, so the release from myocardium or red or white blood cell, we call it anadole. So, so-called heart-specific isoenzyme are present in plasma. Okay, release from liver when the organ is damaged, we call it as catadol. Okay, next we move on to CK, creatine kinase. Okay, there are three principal CK isoenzyme. Okay, each comprising two polypeptide chain, either B or M. So this give the dimer BB, MB, and MM. Okay, so dia combine lah CKBB, CKMB, and CKMM. Okay. For skeletal muscle, alright, has a very high total of CK content, and then 98% normally comprise CKMM. This one is for skeletal muscle. So skeletal muscle kita akan banyak jumpa CKMM. And then 2% of it from CKMB, and then CKMB may rise to 5 to 15% in some patient with muscle disease and also athlete during post-training. Okay. While for cardiac muscle has high CK content, okay, it comprises 70 to 80% of CKMM and 20 to 30% of CKMB. Okay, as general rule, cardiac muscle is the only tissue with more than 5% CKMB. Okay, although it is 20 to 30%, it's already considered high level. Okay, sebab kalau kita tengok kat skeletal muscle, hanya 22% of CKMB. Okay, other organs such as brain, certain contain less CK, which is CKBB. However, rarely appear in plasma and is not of diagnostic importance. Plasma normally contains more than 95% of its CK as CKMM. Sama jugalah macam skeletal muscle. Okay, high level of CK sometimes large due to myocardial infarct, trauma or surgical operation, intramuscular injection, comatose patient, diabetic ketoacidosis, acute renal failure, hypothyroidism, and after prolonged muscular exercise. Okay, for unfit individual. Okay, this is the CK isoenzyme. Okay, each comprise two polypeptide chain, which is either B or M. Okay. Okay, so for CKBB, CK1 found mainly in brain. Okay, released by brain cell. Okay, while for CKMB, CK2 found in the cardiac and skeletal muscle. Okay, while CKMM, CK3 found in muscular injury. Alright, let's take a look at the creatine kinase and muscle disease. Okay, for muscular dystrophy, okay, this disease cause progressive weakness and loss of muscle mass. Okay, high plasma CK activity is present from birth. Okay, during the early clinical stage of the disease, very high activity usually present, but then it falls as the terminal stages of the disease are reached. Okay, And then in malignant hyperpyrexia, it is a rare condition but very serious disorder. It raises body temperature, convulsion, and shock following general anesthesia. Many patients show evidence of myopathy. Myopathy, which muscle fiber do not function properly. Okay, it's a condition of muscle do not function properly. Okay, and then miscellaneous muscle disease. CK is variably increased in various myopathies, include that due to alcohol, and also raised in polymyositis. Okay, and also we can find it in neurogenic muscle disease, where plasma CK usually normal in peripheral neuritis, poliomyelitis, and motor neuron disease. Okay, now let's take a look at the next enzyme, which is aminotransferases, as aspartate aminotransferase and transferase, or we call it as AST. Okay, this is present in most tissue, but especially in skeletal and muscle cardiac muscle, liver, and also kidney. Okay, it is used mainly in investigation of patient with suspected MI, myocardial infarct, and liver disease. Okay, so the normal value of AST is usually 0 to 41 IU at 37 degrees Celsius. Okay, in ascites MI, serum activity rises sharply within the first 12 hours, with a peak level at 24 hours or over, and a return to normal within 3 to 5 days. Okay, the rise depends on the extent of infarction, which is more than 350 international unit per liter are due to massive infarction. Kalau dia punya level lebih daripada 350, kita boleh assume that the infarction is quite bad lah. Okay. Alright, next, alanine aminotransferase, ALT. Okay, this ALT is widely distributed. We can find it in many tissues in our body. Its concentration in most tissues is considerably less than AST. Okay, but in liver, the activities of the two enzymes are about the same. Okay, ALT activity is most often measured as one group of liver function tests. You all ni tak confused tak AST and ALT? ALT ni lebih spesifik to liver. Okay, the tips untuk you ingat ALT, you just remember L in the middle. L is for liver. Kan? Tapi dua-dua ada. Cuma ALT is more specific for liver disease. Okay. Alright. Since it is more liver specific than AST, both ALT and AST levels are increased in liver disease, but ALT is more pronounced compared to AST. Okay, because it is liver specific enzyme. Okay, next, let's take a look at the next enzyme, which is alkaline phosphatase, ALP. Okay, it displays maximum activity level in the pH ranging from 9 to 0.5. Alright. Okay, for liver, bone, placenta, and intestine are clinically important source of plasma ALP activities. Okay, so this is the main source of ALP. It is possible to determine the tissue origin of increased alkaline ALP activity in serum by electrophoresis immunoassay, and other methods. So ALP attached to cell membrane, suggesting an associated between ALP activity and membrane transport. Alright, plasma ALP activity might be significantly increased compared to the normal level in adult for entirely physiological reason. Usually we can see high ALT in normal pregnancy, okay, where it is released from placenta, okay, may cause total activity in plasma to rise in the second and third trimester to about twice normal adult level, okay. And then we also can find high level of ALP in infancy and childhood, where the upper range value here is as much as 3 or 4 times the adult value. Okay, this is due to direct result of the intensive osteoblastic activity associated with normal bone growth. Okay, osteoblast secrete ALP. Okay, so osteoblast tu dia punya function to build or to break down the bone. To build, kan? To build. Alright, so the level of ALP is high in children. Okay, milk containing fat may also cause transient small increase in plasma intestinal ALP activity. Blood for ALP measurement should preferably be collected from patients who have not eaten recently. So the best is take their fasting blood sample. Alright, changes in activity due to disease. Okay, it is activity is often greatly increased when there is cholestasis, whereas hepatocellular damage causes relatively little increase. Okay, in bone disease, plasma ALP raise when there is osteoblastic activity, such as in Paget's disease, hyperparathyroidism, rickets, and osteomalacia. Osteomalacia. Alright, next one is gamma glutamyl transpeptidase, GGT. Okay, can be found in kidney, liver, biliary tract, and also pancreas. Okay, when there is liver disease, the GGT will be high and together with ALP. Okay, this is an indicator for cholestasis. Okay, other liver disease, the GGT will be higher than ALP. This indicate hepatocellular damage. Okay, for high GGT level, it might due to drugs. Okay, anti-epileptics or due to alcohol. For bone disease, there is no raise in GGT, therefore help to identify the tissue of the origin, a raise of plasma ALP activity. Okay, next one is alpha amylase. Okay, it present in the pancreas and it's normally present in pancreas and salivary glands. Okay, enzyme for diagnosis pancreatic enzymes. Okay, plasma amylase is derived from the pancreas and salivary glands. Thus, pancreatic juice and saliva contain high concentration of amylase. Alright, the estimation of plasma amylase activity is mainly used to diagnose acute pancreatitis. Okay, and also it is useful to diagnose intra-abdominal condition. The normal value of alpha amylase is between 28 and 100 international unit per liter. Alright. Okay, for a high level of amylase, which is 5 to 10 times the upper reference limit, it might due to acute pancreatitis and also severe glomerular impairment. Okay, for moderate increase, which is up to 5 times the reference limit, it might due to acute abdominal disorder, acute cholecystitis, which is inflammation of gallbladder, and also perforated peptic ulcer, intestinal obstruction, and also might due to salivary gland disorder. Okay, now let's move on to the biochemical test for myocardial infarct. Okay, so basically after the incident of myocardial infarct, a number of intracellular protein are released from the damaged cell. Okay, maksudnya enzyme tu release daripada which organ? Myocardial infarct. Heart, kan? Bukan kidney ya. Okay, so during the heart attack, there are several enzymes are released. Okay, so major diagnostic interests include enzymes which are CK, CKMB, AST, and lactate dehydrogenase. Okay, and also we can also detect a high level of myoglobin and troponin 1 and troponin T. Okay, enzyme will be considered in the greatest detail here since they are the most commonly used indices of MI. Okay, so basically after myocardial infarct, the time course of plasma enzyme changes always follow the same general pattern. Biasanya the half-life of the enzyme, the pattern, the enzyme release, the peak of the enzyme is similar. Okay, after an initial lag phase of at least 3 hours, during which activity remains normal, there are rise rapidly to a peak between 18 to 36 hours. Okay, activity then return to normal at rates that depends on half-life of each enzyme in plasma. Okay, rapid rise and fall of CKMB activity and relatively prolonged rise of LD activity should be particularly noted. Faham tak? CKMB ni dia akan cepat naik, lepas tu cepat turun. Meanwhile, LD, for LD, dia akan lambat naik dan dia lambat turun. Okay? Okay, so this is a clearer picture of enzyme activity post myocardial infarct. Okay? So during myocardial infarct, the time sequence of serum total CK after myocardial infarct begins to rise at 4 to 6 hours. Okay, mula-mula CK, total CK ni dia akan naik lah. Dia akan naik within the 4 to 6 hours after the incidents and peaks at 24 hours. Dia akan peak at 24 hours. And then return to normal after 3 to 4 days. Okay. Sorry. And then return to normal after 3 to 4 days. Yang ni adalah interval 4 days. Okay. And then let's take a look into the sequence of CKMB. Okay, it rise and turn to normal sooner than the CK, than the total CK. Lagi cepat lah. Okay, it rise within 3 to 4 hours. Okay, and then return to normal in 2 days. Okay, and then let's take a look at the heart specific enzyme, which is LDH. It rise after 12 to 24 hours. Lambatlah dia keluar. Okay, and then peak after 3 to 5 days. They peak after 3 to 5 days and then return to normal after 7 to 12 days. Okay. Kalau kita kalau patient tu dah myocardial infarct, kita tengok selepas seminggu kita tengok masih dia punya LDH masih ada, maksudnya dia punya incidence of MI tu kita boleh cakap seminggu yang lepas lah, tapi kita dah tak dapat tengok the CKMB sebab CKMB habis berapa hari? Within 2 days dia dah habis, dia dah tak ada. Okay. And then time sequence of troponin, which is non-enzyme test, it increased within the first 2 to 3 hours after the onset of MI, and then normalized within 7 days. Okay, this is the changes of plasma enzyme during myocardial infarct. Alright, then after the incidence of myocardial infarct, okay, doctor will do an intervention on of thrombolytic therapy. Okay, this thrombolytic therapy is the use of drug to break down or to dissolve the blood clot after the myocardial infarct. Okay, which are the main cause of both heart attack and stroke. Okay. So, in patient with thrombolytic agent, okay, the general pattern of plasma enzyme activity changes in slightly modified. Okay, following a successful therapy, like for example, streptokinase, there is a washout of enzyme from the infarct area, and plasma enzyme activity rise rapidly to each an early peak at 10 to 18 hours. After the treatment, we can see the changes of the enzyme activity. So, the optimal time for blood sampling, okay, in most patients, a minimum of 2 sample is advisable, usually sufficient lah, before and after the treatment. Okay, which is first one at baseline, admission of sample in which to compare subsequent result, and then a sample taken between 12 to 24 hours after the onset of symptoms. Okay, it is very rarely of any value to take sample of plasma enzyme studied after 48 hours from the onset of sample that suggests diagnosis of myocardial infarct. Right. So, the selection of enzyme test for MI. Okay, plasma CK, possibly with CKMB. Alright. Measurement are requested most often. Okay, remember CKMB for myocardial infarct. Okay. Less often, total LD or specific LD may be requested, particularly if more than 36 hours. Okay, kenapa second option is LD? Sebab kalau more than 36 hours tu maksudnya CKMB dah tak ada, kan? Dia dah clear, dia dah rendah lah after the episode of chest pain. Alright. Recommended plasma enzyme test for CK and heart specific LD on all patients suspected having MI must be done within the 48 hours. Okay. In many patients, plasma enzyme test might unnecessary since electrocardiogram ECG often provide evidence of infarction. Okay. However, it is possible to misinterpret ECG traces, especially in the presence of arrhythmias, irregular heartbeat. Okay, and the ECG is by no means always abnormal in patient who have recently had a myocardial infarct, sebabnya dia punya heartbeat masih belum stable. So we have to do it together with analysis of enzyme. Okay, enzyme plasma test. Okay, so enzyme measurement can provide an indication of infarct size and also the prognosis. Okay, so plasma enzyme together with ECG is a complementary in an investigation of patient with suspected myocardial infarct. So this is the plasma enzyme versus ECG, the diagnostic procedure, the sensitivity and the specificity. Alright, so we have come to the end of the topic. So this is the take-home note for you all. Okay, first you have to remember enzymes are present in a high concentration in cell. Okay, and are released following tissue damage, increased cell turnover or infection. And enzyme release is modified by intracellular location, and enzyme are eliminated from plasma at different rates. Okay, and then the pattern of enzyme present in plasma generally reflects that of the damaged tissue. Okay, in liver disease, we usually use ALT, AST, which greatly rise in hepatocellular damage, while ALP and GGT is always indication for cholestatic disease. While in myocardial infarct, enzyme particularly CK and CKMB usually become raised after a lag period of 4 to 6 hours after the onset of symptoms, and it reached its peak at 18 to 30 hours and return to normal within 3 to 7 days. Okay? Semua orang okay? Semua orang dah tepu dah